Hello and welcome to the health program on Trust TV. I'm Aisha Salihu. On this week's episode of Healthy Living, we're taking a look at disease outbreak and advisory. These diseases are the Lassa fever and cerebrospinal meningitis in Nigeria. As of January 22, the country's health ministry says it has recorded a concerning surge in Lassa fever cases, with a total of 486 cases identified across the country. Out of these cases, 134 have been confirmed, resulting in 21 tragic fatalities. The recent suspicion is in the Federal Capital Territory, where the Federal Capital Territory Administration has raised an alarm over resurgence of Lassa fever, with 4 suspected cases but 2 confirmed cases in Abuja. The rise in the number of infections has sparked alarm among health authorities, prompting urgent measures to contain the spread of the disease. Health authorities emphasized the importance of early detection and seeking prompt medical attention for anyone showing symptoms associated with the disease. The Public Health Department in the FCT, at a press conference, says to tackle the spread of the disease, they have activated Emergency Operations Center. Let's take a look at the conversations during the conference that had healthcare professionals and health reporters in attendance.
Particularly for Lassa fever, the drugs are not available even in the private sector. It's only available in designated health facilities. Like she mentioned, almost all our secondary health facilities has this medication, and it's free of charge.
Otherwise, very expensive.
It's free of charge. Otherwise, it's very expensive. In fact, most of the time, you cannot even get it in the private health facility. The other issue about COVID response, that is it going to be like that of COVID response? You see, COVID was a pandemic, whereas this is not anything of such. Like we are talking about just 2 cases in FCT in the last how many months? So you don't expect the same response. And like we are saying, we are doing everything possible to ensure that we minimize these, incidents so that it doesn't get beyond this, and that is why we are doing. So you may not see the kind of COVID response that you had there because they are not of the same proportion.
On the 15th of January 2024, the FCT Public Health Department received an alert from a clinician in Buhari General Hospital. A patient was brought in, and the symptoms and signs looked like Lassa fever. According to our processes here, they are to alert this department, which was done, and the department moved swiftly into action. Rapid response team was mobilized, and investigation revealed that they were high-risk contacts of their mother. Now, their mother are taking these 2 kids to Bauchi for a holiday. In Bauchi, at the Tafawa Balewa Teaching Hospital, she was confirmed as a case of Lassa fever when she started showing symptoms, and she passed on in Bauchi. At this point, the children's father, who is quite educated, knew it was a contagious disease, sent a driver to go and pick the remaining 2 children back to Abuja. The children came back to Abuja on the 12th of January. On the 15th of January, the children were presented at our hospital, and based on a high index of suspicion from the case history and from the fact that their mother had died from a hemorrhagic fever and confirmed as a Lassa fever case, we immediately swung into action, and the public health response commenced. The response includes daily monitoring of the symptoms of the other children who had come in contact with the mother. And thank God for this, one of the children was confirmed positive and was immediately moved to the National Hospital, Abuja. He was starting to show signs, and because of our monitoring, we took a sample, sent to the National Center for Disease Control, and it came out as positive. The patient is currently in the National Hospital receiving care, a 14-month-old baby. And the other child that went is a 13-year-old adult. She is not quite showing signs and symptoms yet, but she's on prophylaxis medication. Prophylaxis is something that will prevent. We are giving her medicines to prevent the illness from coming up, whilst still monitoring this whole family according to our standard operating protocol. This press conference became necessary when a second positive case was reported by clinicians at the Abuja University Teaching Hospital on the 16th, independent of this first case. And if two different people are coming from two different places into here, it is time for us to activate the protocol according to the Public Health Department. But we are glad to say that there hasn't been any mortality, meaning that nobody has died so far from Lassa fever here in Abuja. And the two cases we have are responding to treatment and are getting better. I'll talk a little bit about Lassa fever for the general public. It's a viral disease. We call it a viral hemorrhagic disease, meaning that it causes bleeding disorders. You can just start bleeding from every orifice, vomiting blood, passing of blood, blood from the nose, blood from the ear, when it is not treated. It is caused by the Lassa virus. It has been reported in other countries like Guinea, Sierra Leone, and Liberia as endemic, meaning that it is there. Nigeria is fast approaching that endemic situation with some states called hotspots where they see it regularly. Annually, the FCT experiences sporadic infections between November and April. So this is the period we expect, and we are ready for this surge. However, because of our proactiveness, not waiting for it to happen, we are able to nip it in the bud by having only 2 cases so far, and we have not reported any death in the FCT. Now, the mode of transmission is through a rat, a type of rat called mastomes. All those things are not necessary for you to know. Natalenis is the type of rat, but rat is rats. And they are the reservoir for the virus. The main mode of transmission, this is for the general public, is when rats put droplets of their saliva, of their feces, of their body fluids on the food we eat. Dry food, cooked food, that is the main mode of transmission. Now, from human to human will have to be through body fluids, blood, feces, vomitors, and all. That is why healthcare givers are at a very high risk of contacting this disease. Part of the essence of this press conference is to let private hospitals and all hospitals operating in the FCT start to know the signs, know the symptoms, and have a very high index of suspicion, and refer to the centers which we will tell you today. Because if a patient comes in vomiting, and you without gloves, not knowing what is wrong, you start to clean with mop, you don't disinfect, put that hand in your mouth, straight to Lassa fever. That's what it is. We are telling healthcare givers and the general public to be on the lookout. 80% of cases that have Lassa fever can be asymptomatic. They won't even show any sign. However, in about 20% of cases, the disease progresses. And at times it can be virulent. That means really bad. The symptoms are neither here nor there. For healthcare givers and hospitals and chemists and pharmacists that act like hospitals, this is for them. They have to look out for high-grade fever, over 38.5 degrees, that is not responding to treatment. You treat for malaria, treat for typhoid, yet this patient still has a fever. There has to be history, ask for history of contacts, or if there are rats in their home. And at the late stage is when we start to see bleeding from all orifices of the body. At this time, it takes a lot to save the patient. The very end stage is multi-organ failure. The kidneys start to fail, the liver, the heart, and it leads to death. The good news is, if we catch it early, we know these early signs and symptoms, nobody has to die from Lassa fever. Current situation nationally, as of 22nd January 2024, Nigeria has recorded cumulatively 486 suspected cases. We have confirmed 134 cases, and with only 21 deaths. Compared to when Lassa fever first showed up in Nigeria, we were losing people in hundreds. Now we confirmed 21 deaths, which gives us a fatality rate of 15.7%. The FCT has recorded 4 suspected cases, 2 confirmed cases, and I'm glad to say that this secretariat, in active conjunction with you partners, World Health Organization, Public Health Department, has not recorded any death due to Lassa fever. Right now, we do not hope to record any death. Both cases are responding to treatment. Commodities are being pre-positioned as requested by the facility.
Health facilities had the ribavirin pre-positioned, and so we still have them, so anybody that wants it can have. If we don't, NCDC will supply. Now, most of the treatment is free, the investigations are free, the treatments are free, but sometimes, as some patients might have other complications that the doctors need to work on. So at that point, I think most patients, usually it's not much the patient's health. And for some of the patients we're talking about, over the weekend, the Mother Secretary actually supported the treatment of that patient at the National Hospital. So the government is fully aware of her responsibilities to these patients. Then somebody asked a question about risk communication, and yes, members of this team are ready and willing day and night to come to any of your facilities and respond and communicate with the public about information about on Lassa fever. Please, let's take this opportunity to remind people in the public.
Drawing from the discussions at the press conference, experts are saying there is no need for alarm in the FCT, but necessary precautions must be taken, while health workers should have a high index of suspicion, and upon suspicion of any case, contact the FCT Public Health Department and refer immediately to the National Hospital and the University of Abuja Teaching Hospital in Gwagwalda. Now to the cerebrospinal meningitis outbreak in parts of the country, especially in Jigawa State at the moment. The federal government, through the Nigeria Center for Disease Control and Prevention, has alerted Nigerians to the possible outbreak of cerebrospinal meningitis as the country settles into the dry season. Meningitis is more prevalent during the dry season, which comes with dust, winds, and cold nights. The disease claimed 190 lives across the country between 2022 and 2023. Statistics reveal that Nigeria recorded 2,765 suspected cases and 303 confirmed meningitis cases, with 190 deaths across 140 local government areas in 30 states. The meningitis belt includes all the 19 states in the north, the FCT, and some southern states such as Bayelsa, Cross River, Delta, Ekiti, Ogun, Ondo, and Osun State. Let's now join Farida Mohammed Munir, a senior scientific officer and the coordination lead for the National Cerebrospinal Meningitis Technical Working Group at the Nigeria Center for Disease Control and Prevention, for a better understanding of the contents of the advisory and the way forward. Welcome to the program, Farida.
Hello, good afternoon.
I understand that the NCDC recently released a public health advisory, more like an alert on the cerebrospinal meningitis. Now, I'd like for you to, elaborate on what the cerebrospinal meningitis entails and also the contents of the advisory as we proceed.
All right, so cerebrospinal meningitis is a bacterial infection that affects the spinal cord and the brain. So we normally have sporadic cases across the country, and usually during the dry season, it becomes more prevalent. So currently we have about 103 suspected cases, national cases, and Jigawa State has about 58 cases. So there's an outbreak in Jigawa currently. But as you know, NCDC is the Public Health Institute in Nigeria. It has adequate public health systems to detect and respond to cases of meningitis.
You have talked about the disease as being attached to the dry season, and what would you say are the cultural practices that aggravate this? I mean, why so, and somehow making it more prevalent, leading to a possible outbreak? Let's also explore the risk factors and symptoms of meningitis.
Cerebrospinal meningitis is a bacterial infection. It's a respiratory infection. And so there are environmental factors and there are human behavioral factors. An example of the environmental factors are for instance, the Hamilton season where we have more cases. It's because of the dry wind, the heat that irritates the throat lining. And that's the way the bacteria goes into the body, into the bloodstream through the blood-brain barrier. And then the human factors that I can say the top three ones that I can mention right now is overcrowding, being in crowded areas, communal livings. So it makes the infection spread easily because of the close proximity. And then, of course, poor ventilation within those crowded areas. And then you have poor respiratory and hand hygiene. People don't wash their hands as often. They don't sanitize as often. And then just like COVID-19, if you're sneezing or you're coughing, coughing to your elbow. And the third major factor is immunization coverage. With low rates of vaccination coverage, it increases the vulnerability to get meningitis.
Thank you so much, Farida. You did talk about vaccination, so that means this disease is preventable, right? Now, let's also explore vaccine coverage for the disease.
Okay, first of all, public health measures are always the priority. That's promoting hygiene, education, awareness, and of course, community engagement to let people know the risks involved in contracting meningitis. And then you mentioned vaccination. Yes, herd immunity is important. And there's a very interesting story with vaccination. Initially, meningitis, the serotype A, used to be the one that causes epidemics in Nigeria. But because of vaccination, the routine vaccination that was introduced, we do not detect meningitis A anymore in the population. So now there's a new strain that's gaining ground. So the most recent outbreaks that we've had in this country are all meningitis C. So vaccination does work. If it's done regularly, you improve your children. You don't miss your routine vaccinations. It actually is the best form of prevention that we have.
You have stated that this disease is more prevalent in children, but adults also come down with meningitis. Could you put us in the right direction and more elaborately on safer practices for people and also healthcare workers?
Like I mentioned earlier, public health measures, vaccinations, improved living conditions, have well-ventilated rooms, limit the number of people that live or sleep over in a particular room, personal hygiene, respiratory hygiene, when just like COVID-19, because it's all a respiratory infection. When you're coughing and you're sneezing, cough into your elbow, wash your hands frequently. And then, of course, for healthcare workers, they need to have a high index of suspicion for CSM. During this season, they should be able to identify this as a possible CSM, suspected CSM case, and then take a lumbar puncture, which is how we diagnose how we diagnose meningitis and how we find out what organism is causing this epidemic. And before treatments, before giving them antibiotics, take the sample, which is a spinal tap, taking the fluid in the spine. And then, early diagnosis, quick treatment.
I like that you talked on treatment. I was going to come to the area of treatment because it is not enough for us to talk about prevention and safer health practices without talking more extensively on treatment procedures. Now, at what point would you say this particular case of meningitis, say after diagnosis, has transformed into a severe case where treatment is pertinent, and is the disease fatal?
Yes, actually, it's very deadly. And the thing with meningitis is it's quick. It can kill in a matter of hours. So before we talk about early diagnosis and treatment, which I hope healthcare workers would have high index of suspicion, and treat quickly, families should be able to identify too. And that's when we come to the symptoms. So remember I told you that meningitis affects the brain and the spine, the blood-brain barrier. It causes swelling. So you will have pressure in the brain and in the spine, and then you have symptoms like severe headaches. The child will be lethargic, meaning that they'd be sleepy all the time. They would vomit, have nausea. So it's a complete behavioral change in a child. And then sometimes you see red blotches on the skin. So these are all symptoms and signs that if parents or family members see, they should quickly take a child to a primary healthcare center or hospital.
Farida, as an expert with the NCDC, I'd like for you to state it clearly which areas or parts of the country is the advisory as released by the NCDC earlier targeting, and what is the meningitis belt at the moment?
Initially, meningitis was associated with the northern states of the country, but because of climate change, things are changing. And of course, we report better now because NCDC has a surveillance system, several surveillance systems. There's a SORMAS, which is a digital system. It's a digital platform for reporting cases, infectious diseases. And there's the event-based surveillance, incident-based surveillance. The NCDC strategic plan has plans for community-based surveillance. So there are more reportings these days. So we're getting cases from all over the country in states that we would not assume that they would be meningitis. So it is basically an advisory for the entire country. I don't think that we should just say it's the northern part. We've seen it in all parts of Nigeria.
You have attested to the fact that there are still cases of vaccines hesitancy in parts of the country. What can you tell us about the vaccines for meningitis? How safe it is, how accessible and available in the country?
Well, earlier I mentioned that the Neisseria meningitis A has been eradicated in the population, and it's because of routine vaccinations. Now, Neisseria meningitis C is a tricky situation because the vaccines for that are expensive, and they're not readily available globally. So even when there's an outbreak, we would have to use the ICG, which is a coordinating group for vaccines, for specific vaccines, and the meningitis vaccine is part of it. So the vaccine that covers then the NMC pathogen is not readily available. We would have to order it, and that is when it's brought into the country and then treated during an outbreak. But there are plans, there's a global plan, which is a global roadmap to defeating meningitis by 2030. So in this plan, there are plans to make that vaccine that covers the C strain to be in routine vaccinations and be readily accessible to countries. So the meningitis belt is basically countries from the eastern part of Africa to the western part. So Nigeria completely cuts across it. So we can't really say this advisory is just for the northern part, it's for the entire country.
Still in line with the advisory, I'd like for you to state the statistics of meningitis, say from 2022 through 2023, and now that there is a high suspicion and I'm looking forward to 2024.
So since October last year, 2023, we've had 15 states report 103 suspected cases and 14 deaths. And for Jigawa State, it's about 58 cases with 7 deaths. And the most pathogen, let me take that from the top.
Okay, no problem.
Okay. All right, so for meningitis, we start the epidemic here in October. So last year, October 2023, till date, we've had 103 suspected cases so far with 14 deaths and 15 states in the country reported. So the state with the highest number is Jigawa State with 58 suspected cases and 7 deaths. So we have a National Cerebrospinal Meningitis Technical Working Group that is multi-sectoral. It's all inclusive with partners from the WHO, from UNICEF, from US CDC. So we coordinate responses to activities in Nigeria.
Thank you so much for your time. I'd like to have your final words on this advisory very quickly, just before we let you go.
So I think the most important thing is to say that prevention is the best care. So vaccinate your children, do not miss any routine vaccination, and then have proper hygiene, respiratory hygiene, hand hygiene, wash your hands. When you're coughing or sneezing, you cough into your elbows. If someone is infected, don't get into close proximity. And if you are in closed areas, have well-ventilated areas.
Thank you so much, Farida Mohammed Munir, Senior Scientific Officer and the Coordination Lead for the National Cerebrospinal Meningitis Technical Working Group at the Nigeria Center for Disease Control and Prevention.
Right, thank you very much for having me.
This is the much we can take at the moment. We do hope to reconnect with you in subsequent episodes of the program to have your thoughts on this subject. And that concludes this week's episode of the program Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores. And get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I'm Aisha Salihu. Thanks for your time.